Hello, guys. Welcome back to Intellect Medicos, where learning is made easy. Today is World Sepsis Day. Each year on September 13th, supporters all around the globe organize events to raise awareness for sepsis. So here I am, putting all my efforts to let you know some recent facts and changes in sepsis definition and management. Sepsis, a syndrome of physiologic, pathologic, and biochemical abnormalities induced by infection, is a major public health concern. It is a leading cause of mortality and critical illness worldwide. Sepsis definition was first given in 1991, then renewed in 2001, in which four terminologies were used: SIRS, which is Systemic Inflammatory Response Syndrome, sepsis, severe sepsis, and septic shock. And in 2016, they came up with new definition of sepsis, which is given as SEPSIS-3. And also they have eliminated the term SIRS and severe sepsis. Coming on to new definition of sepsis or sepsis-3. It is life-threatening organ dysfunction caused by dysregulated host response to infection. The original concept of sepsis as infection with at least two of four SIRS criteria focused solely on inflammatory excess. Sepsis is now recognized to involve early activation of both pro-inflammatory and anti-inflammatory responses. So it is basically dysregulated host response. Severity of organ dysfunction has been assessed with various scoring systems that quantify abnormalities. The predominant score in current use is SOFA score, which is Sequential Organ Failure Assessment. This score has six systems. Each system has score 0 to 4. So maximum score is 24. Now let's see what all components are there in SOFA score. Starting from CNS, it is assessed by Glasgow Coma score. In respiratory system, you have to see PaO2 by FiO2, which is the ratio of partial pressure of oxygen in arteries and fraction of inspired oxygen. In cardiovascular system, you have to see MAP, that is mean arterial pressure. In hematology, see platelet counts. For renal function, see creatinine levels and urine output. And in hepatic, bilirubin is to be taken into account. According to task force, organ dysfunction can be identified as an acute change in total SOFA score more than equal to 2, consequent to the infection. This SOFA score more than equal to 2 reflects an overall mortality risk of approximately 10% in general hospital population with suspected infection. Even patients presenting with modest dysfunction can deteriorate further, emphasizing the seriousness of this condition and the need for prompt and appropriate intervention if not already being instituted. Now, there is another score called as qSOFA score or qSOFA. Patients with suspected infection who are not admitted to the ICU can be promptly identified at the bedside with qSOFA. It has three components which can be remembered as HAT, where H stands for hypotension, that is SBP or systolic blood pressure less than 100 millimeters of mercury. A stands for altered mentation, that is GCS less than 15, and T stands for tachypnea, that is respiratory rate more than 22 per minute. Now in various scoring systems, we have different value of SBP and respiratory rate. So how to remember these values of qSOFA? Just remember this guy sitting on a sofa wearing a hat. He is sitting on his bums on sofa. So remember SBP with 100, two zeros for bums. Also in case of respiratory rate, it is 22. So 2 stands for 2 bums. So this is how you can remember. Now in sepsis-3, they have given new definition of septic shock. Septic shock is defined as a subset of sepsis in which underlying circulatory and cellular metabolism abnormalities are profound enough to substantially increase mortality. Patients with septic shock can be identified with persisting hypotension requiring vasopressors to maintain MAP more than equal to 65 millimeters of mercury and having a serum lactate level more than 2 millimoles per liter, despite adequate volume resuscitation. Now, management of sepsis is based on Surviving Sepsis Campaign Bundle 2016, which is currently updated in June 2018 or June 2018. The most important change in the revision of SSC bundle is that 3-hour and 6-hour bundle have been combined into single 1-hour bundle with the explicit intention of beginning resuscitation and management immediately. So within 1 hour, the things which you need to do whenever you suspect sepsis or septic shock are: first of all, measure lactate level and re-measure if initial lactate is more than 2 millimoles per liter. Second, obtain blood culture prior to administration of antibiotics. Third, administer broad spectrum antibiotics. Fourth, begin rapid administration of 30 ml per kg crystalloids for hypotension or if lactate is more than equal to 4 millimoles per liter. And the last is apply vasopressors if patient is hypotensive during or after fluid resuscitation to maintain MAP more than equal to 65 millimeters of mercury. So this is just a brief about recent changes or updation in definition and management. So, on this World Sepsis Day, do spread awareness about sepsis amongst your friends by sharing this video with them. And do not forget to subscribe our channel to get the updates about our new videos. Thanks for watching this video. See you guys in my next video. Good luck.